Hey guys, I hope you're doing well. In this video, I'm going to talk about some of the different topics I've seen in medical news. So I was scrolling and I kind of came across an article that talked about taking too many medications. So basically in the article, a physician was reviewing how to kind of approach or handle taking too many pills. I'm going to put a link to the article below so you guys can take a look at it. But in terms of my thoughts about taking too many pills, as a geriatrician, one of the principles we're taught is deprescribing, meaning removing some of the medications that our patients may no longer need, or if the medications are causing side effects, perhaps lowering the dose or looking for an alternative medication, or perhaps not even treating that medical condition if it might not be prolonging the individual's life. So in terms of deprescribing for my own patients, what I usually do if they are safe expressing frustration about taking so many medications, I'll review their medications and I'll look for certain medications or even supplements that can be discontinued. Sometimes patients are taking additional supplements that are not prescribed, and if we get rid of those, they'll feel like they're taking less pills, and that'll improve their overall well-being and quality of life, not having to think about taking so many pills and supplements. Another thing that I think that's important is to talk to the pharmacist. As a physician, I often call my patients pharmacists and talk to them about the medications my patients are taking and see if there's a way to give a 2-in-1 combination pill. For example, some of the blood pressure pills, if there are 2 blood pressure pills, they can actually be put in a 2-in-1 combination pill, and that reduces the number of pills that an individual is taking. Other instances, we can also talk or look and see if one medication is being prescribed to treat another medical problem. For example, for individuals that have diabetes, metformin is a common medication, and this medication can cause B12 deficiency. And then the individual ends up being diagnosed with B12 deficiency, and then they have to take a pill or injection to fix the B12 deficiency. So it's important to look at the whole list of medications as a whole and see if we're causing problems with those medications. Another thing that can cause frustration with taking medications is just confusion. So for example, somebody's taking multiple meds 3 or 4 times a day and all the times are staggered. That can be very frustrating. So one of the things I do in partnership with my patients' pharmacists is ensuring that my patients who need it are having their medications bubble packed. Having your medications bubble packed can really simplify a lot of things. And then also talking to other specialists. For example, there's a condition called atrial fibrillation where the heart is skipping beats, and that increases the risk of stroke. So in many cases, patients are put on blood thinners to reduce the risk of stroke. But as patients get wiser, the risk of bleeding can increase. So we might coordinate with a patient's cardiologist. Maybe the patient needs a reduced dose because they're somebody who's at high risk of bleeding. So reduced dose of the blood thinner, or maybe there's something else that can be done, especially if they've had bleeding in the stomach, to manage that condition. For example, maybe they don't need the blood thinner anymore. We'll compare the risk of having a stroke versus the risk of having another stomach bleed, and together with the patient's cardiologist, we might decide it's better for this patient not to take this medication at all and perhaps live with the smaller risk perhaps of having a stroke. And again, would also, in addition to work with the cardiologist, I'd make that decision together with the patient as well and make sure that they understand the risk versus benefits of taking that medications. But overall, I think it's a conversation worth having. If you as a patient feel like you're taking too many pills, talk to your doctor, ask questions, and work together with them and work together with your other specialists to see if there's a way that your medications can be reduced. I hope you found that useful and informative. If you like my healthcare content, please share it with your friends and follow me for more healthcare tips. Bye-bye for now.